Good evening to all of you. I'm Dr. Udari, representing the Medical Subcommittee of All Girls Association of Visakha Vidyalaya. We all are tuned in today to focus on a very important topic to all of us, obesity. Obesity is a complex disease involving an excessive amount of body fat. Obesity isn't just a cosmetic concern. It is a medical problem that increases your risk of other diseases and health problems, such as heart disease, diabetes, high blood pressure, and certain cancers. According to a study which was done very recently in 2019 in Sri Lanka, stated that when Asian BMI cutoff is used, the prevalence of obesity in the urban areas of Sri Lanka is high as 31.2%, which is very alarming. Highest obesity prevalence was observed in the most educated group, and there was high female predominance as well. So I think now you all understand the gravity of this problem. And before we begin, I have an important and exciting announcement to all the Visakhians. Following this program, we are so happy to announce that the Medical Subcommittee of VVOGA would be looking forward to conduct a personalized weight reduction program with individualized dietary plans to all our concerned Visakhians. We are hoping to follow the participants for a period of time until you gain your target weight. So, I would like to invite any Visakhian who is determined to reduce her body weight to register just by clicking on the link and fill in the Google form, which is published in the official Facebook page of VVOG. Without taking much time, let me introduce you all to our expert panelists to discuss on obesity, its associated medical concerns, and ways of managing it. All three panelists are our own past Visakhians. So, our first speaker for today is Dr. Nilangika Sandakumari, who is a consultant physician and currently attached to the Faculty of Medicine, University of Sri Javadipura, as a senior lecturer in pharmacology. She will give us an introduction to obesity. Over to you, Dr. Nilangika. Dr. Nilangika would give us an introduction to obesity and how we measure obesity and all. And she will tell us how we, what are the prevalence of obesity in the country and everything.
Yeah, so thank you very much, Dr. Udari, for your kind words of introduction. And I would like to thank Visakha Vidyalaya Medical Subcommittee of Visakha Vidyalaya All Girls Association for giving this opportunity to address you all regarding obesity. So what is obesity? Obesity is a common, serious, and costly chronic disease. Why do I say that it is common? According to a study that was done in 2017 and 2018, the worldwide obesity was estimated as 42.4%, which is significant. So it is common. And why it is serious? It is serious because it is related with lot of non-communicable diseases such as heart disease, strokes, type 2 diabetes, and certain types of cancers. So it is a serious condition. And these are some of the leading causes of preventable premature death. And it is costly. Why? Medical cost for people who have obesity was estimated as $1,429 higher than those of normal weight. So how do you know whether you are obese or not? You have an indicator called body mass index for you to calculate and see whether you are obese or not. How do you calculate this? You have to measure your weight in kilograms and height in meters and divide the weight by square of height. And the value that you get will give an idea whether you are in the normal weight range, overweight range, or whether you are obese. Now, this picture shows the normal value for BMI. It is 18.5 to 24.9. If you have a BMI of less than 18.5, then we call that you are underweight. If it is more than 25 but less than 29.9, you are overweight. And when it goes beyond 30, you are obese. And you have BMI charts, which you can download from the internet and measure your height and weight. And if you check the height and weight with this chart, you can see whether you are obese or not. But Asian population is different to world population. So you have some modifications for this BMI value for the Asians. Underweight cutoff is the same, but the normal value ranges from 18.5 to 22.9. And overweight is when it is 23 to 24.9. We call a person is obese when his weight, his BMI is more than or equals or more than 25. That is Asian cutoff. And Dr. Udari at the beginning told us that there was a recent study done in Sri Lanka in 2019 showing that obesity is a major problem. So I thought of telling a little bit about this study. It was done in 2019 by Dr. Noel Somasundaram, consultant endocrinologist in the National Hospital of Sri Lanka, with his team, which revealed more than 2/3 of adults in the studied population, which is Colombo Hospital, patients attending to the endocrinology clinic in National Hospital of Colombo. More than 2/3 of adults were either overweight or obese. So as you can see, this is a significant problem in Sri Lanka. So apart from BMI, you have another indicator which you can use to see whether you are obese or not. That is called waist-hip ratio. So you can calculate that by yourself. Take a measuring tape and measure your waist just under your lowest rib. And measure your hips at the widest portion of your buttock. Then you have to divide the waist measurement by hip measurement to get the ratio. The ratio that you get give an indicator about the fat distribution in your body. For a male, it has to be less than 0.95%, and for a female, it has to be less than 0.86%. When it goes above this cutoff value, then it means the fat distribution in your body is not in the optimal way. That most of the fat is around your waist rather than at your hips. That is an indicator showing that you have a higher risk of heart disease and type 2 diabetes, right? And the risk goes up when the waist size becomes greater and greater. So the waist-hip ratio is a very good indicator showing whether your fat distribution is leading you towards a direction which is not good. Now this picture shows a comparison of waist-hip ratio comparison of two people with two models, apple and pear model. When most of the fat in the body is deposited above the waist, that will give rise to an apple body shape. and most of the fat deposition is below the waist, then it will generate a pear shape. When the fat distribution is in apple shape, that is not good. Most of the fat is above the waist. And when it is below the waist, yes, hip fat is higher. So it is the way that we want the fat distribution to be. So that is about waist-hip ratio. So what are the reasons for this obesity? There are multiple factors. Now in these days, where coronavirus pandemic is there, most of us are doing work from home. So no or lack of physical activity is a major problem. No activity or sedentary lifestyle is a leading cause of obesity. And some have a family history of obesity where their parents or siblings are obese. Then they are also at higher chance of being obese. And the other leading cause is unhealthy food. Food with lot of calories. These days, even young generation tend to take lot of unhealthy food, which has predisposed to childhood obesity as well. And certain hormonal diseases, which we call endocrine diseases in medical terms, can also cause obesity. If your thyroid gland is not working properly, and if there are problems with your pituitary gland, then they also can cause obesity. So the main reasons are sedentary lifestyle, family history, unhealthy food, and hormonal problems. And we need to know a little bit about energy balance before talking about dietary management in obesity. So I thought of giving you an idea about energy balance. Energy balance is the net amount of energy that you take into your body. That equals the energy input. You need to take energy input and energy expenditure, and then see how much energy in excess have you taken in. If you take adequate amount of meals to spend it for your day-to-day activities, then the energy balance is 0. Energy input equals energy expenditure, and you are maintaining weight. But if you eat a lot of high-calorie food and you are not spending it enough, energy expenditure is not that good. You are having a relatively sedentary sort of a lifestyle. These days, I think most of you all are in front of screens, either television, computers, or mobile phones, and there's very minimal physical activity. So when the energy input is higher than energy expenditure, it will result in weight gain. So if you take the total energy expenditure, we spend our energy mainly for 3 things. First thing is basal metabolism. Basal metabolism means the energy that you need for your day-to-day activities. To walk, to sleep, then to sit. For everything you need a certain amount of energy. So most of the energy that we take from our food is spent for your basal metabolism. And then some amount of energy is needed for digestion of food. And the amount of energy that you spend, which you can change, or which you have an authority to change, is the amount of physical activity. If you increase the amount of physical activity, you can increase the amount of total energy expenditure. Now this diagram also shows, this is a chart showing the components of energy expenditure and their percent distribution to the total energy expenditure. You can see most of the energy spent is spent for basal metabolic activities, and physical activity also plays a significant part in energy expenditure. So if you want to lose weight, increasing your physical activity will also help. My other colleagues, Dr. Dushanti and Dr. Virajini, will elaborate more on this. So with that, I would like to ask Dr. Udari to introduce the next speaker who will discuss more about obesity-related issues. Thank you very much.
Thank you very much, Dr. Niratnayaka, for that very informative overview on obesity. Our next panelist is Dr. Lushanthi Kannangara, who is a consultant physician with special interest in geriatrics. She will enlighten us on health issues associated with obesity and its management. The platform is all yours, Dr. Lushanthi.
Thank you, Udari, Dr. Udari, for a kind introduction. Good evening, ladies. First of all, I would like to thank Medical Subcommittee of Visakha Vidyalaya OGA for organizing this timely webinar on obesity. So, as Dr. Niratnayaka mentioned, obesity is common, and it is dangerous, and it is costly. So I'm going to talk about the danger of obesity as well as to show how costly it is. So obesity is a global threat. It is still in the waiting area because we are not fully aware how dangerous this is. So what are the problems associated with obesity? So there can be emotional and physical problems. So first of all, I would like to talk about the emotional problems. So what are they? So when someone is stigmatized, when someone is having obesity, what will happen? They will get social, there can be stigmata of being obese, and they can have other problems like self-isolation, and they can have self-consciousness about their problems, because when they are obese, they always think that they are fat, and they have other people will think differently about them. So this is a part that because they are being stigmatized, and then they become quite helpless, and ultimately this will lead to depression. And again, they can have problems like sleep problems, insomnia, poor sleep, and then they will think that they are not worth enough, and they develop lack of motivation. They can't achieve their targets, especially when they about reduction of weight, and especially their other activities. So they will become less motivated about their goals, and this will lead to anxiety, and ultimately this will end up as severe depression. So this is a cascade, it's a circle. And so these psychological or emotional problems are very important, especially when we are assessing a person with obesity, and also when we are targeting the treatments. And the most important, as Dr. Niratnayaka mentioned, there can be several physical problems related to obesity. So what are they? What are these physical problems? High blood pressure, very common among obese individuals. Type 2 diabetes. So type 2 diabetes are more common among overweight or obese individuals. And heart disease, 3 times more common. Stroke, sleep apnea, metabolic syndrome, high cholesterol levels in their body, osteoarthritis, and chronic back problems. And also digestive problems. What are these digestive? They can have heartburns, and they can develop constipation, and they can have gallbladder related problems like gallstones and infections in the gallbladder. So I will talk to you about these physical problems in detail. So heart disease, what is this? There are some blood vessels supplying the blood to your heart. That is how heart works. They need energy, they need food. The heart also needs everything. So when, especially in obese individuals, they have tendency to get heart blocks. This is a picture showing a normal blood vessels, a normal artery. When they have high cholesterol levels, they have this narrowing of their arteries and this cholesterol deposition, and ultimately will lead to blood clot formation. This is how a person developed a heart attack, and then part of your heart will get less blood supply, and that is you call in medical term myocardial infarction, or in layman we call it a heart attack, where the heart muscle, dead heart muscle. So it is a very dangerous problem. And then what is sleep apnea? So usually when you sleep at night, you have a very good oxygen supply to your lungs. The normal air comes through your nostrils and it goes to your lungs, and then oxygen will go in and carbon dioxide will go out. But when you have obstructive sleep apnea, what will happen? You get this narrowing of your airways. Your air passage get narrowed, and oxygen supply to the lungs will be less, and your body signals this, and then body will tell to your brain that you are not getting enough oxygen, so get up, get up, get up, and suddenly you wake up at night, so you don't get a proper sleep. And this is especially, this is the person cannot feel most of the time this one, but late night they get up. But the other problem that they develop when there is a partial, the part of the airway when it is get obstructed, they can have this abnormal sound creation that is called snoring. So usually the snoring, the partner or the person who is sleeping next to you can hear this, and that person's sleep also get disturbed. So you can see in this picture, so if the other person is snoring, then the other person gets disturbed. So this is also a problem associated with obesity, when there's obstruction or narrowing of your airway. Especially this happens when the fat deposits around this airway due to obesity or due to short neck. So if this can lead to a lot of complications. This can lead to heart attacks, high blood pressure, diabetes, and sometimes high pressures in the right side of the heart, and strokes. And ultimately, some people will need this sophisticated gadget for a good sleep called CPAP machine. So when they are obese, if they have sleep apnea, we need to prevent all these complications. So doctors, sometimes they have to prescribe this machine called CPAP machine to have a good night's sleep, as well as to reduce the complications. And then metabolic syndrome. So I told in my previous slide that there is another entity called metabolic syndrome. This is also a very common problem among obese individuals. So in that, the blood pressure is high, sugar levels are high, and waist circumference is more than 40 inches for men and 35 inches for women. And the good cholesterol, the HDL cholesterol is low, and triglycerides are high. And again, this metabolic syndrome can give rise to a lot of problems like heart problems, liver problems like fatty liver, and they can have these blocked vessels and strokes. So that is again can give rise to several complications. And then arthritis. When your weight is high, the joints cannot bear that weight and develop arthritis of the joint, and ultimately it leads to joint deformity. This is a picture of a normal knee, and this is an osteoarthritic knee. So there is a cushion called cartilage in between these joints, so it gets disrupted and joint spaces are small, narrowed, and first the patient will have pain, and then finally they will end up like this with severe deformity and walking difficulty. So at that stage, we might have to offer surgery like joint replacement surgery, which is very costly, and there are complications related to surgery itself. And other complications like non-alcoholic fatty liver disease, it is a very common disease entity, and that can later give rise to cirrhosis. And varicose veins are high among obese individuals, and subfertility, where inability to have children. This is mainly due to hormonal imbalances, and sometimes obese individuals can have a disease called polycystic ovarian disease, where they have fluid-filled cavities in their ovaries, and this can again cause hormonal imbalances and subfertility, and they can have sexual problems. And not only these non-communicable diseases, the death rate and complications in dengue and COVID-19, these days we are talking a lot about COVID-19. The death rate and complications due to dengue and COVID-19 are high among obese patients. And the physical disability, see how disabled they are. This is actually an extreme obese person, but this not only in extreme obesity, the others also have a lot of physical disabilities. And cancer. So there are some cancers like colon, breast, endometrium is your womb, kidney, esophagus, that is food pipe. The cancers in these areas are common among obese individuals. Around 10% of all cancer deaths a year are related to obesity. Are we aware? Are there any alarming signs to check, or are there any signs that doctors check? So you also can see whether you have any of these. Acanthosis nigricans. So acanthosis nigricans is a black, velvety, plaquey appearance, especially over neck or armpits with some skin tags. This is a feature of metabolic syndrome and also diabetes and some of the cancers. So this is common among obese individuals. And stretch marks. When you become obese, you can have stretch marks, but there are specific stretch marks called purple stripe. This is actually specific to a hormonal disease called high level. When there's high level of cortisol hormone, you can have this purple color stripe. As Dr. Nilangika mentioned, there can be secondary causes for obesity. So this high cortisol or high stress hormone level can cause a disease called Cushing's. So this can have this appearance of purple stripe. And this excessive hair, especially over face or sometimes in the body, called hirsutism. This is also seen among metabolic syndrome and also obese individuals with the polycystic ovarian disease and some of the hormonal diseases, like as I earlier said, excess stress hormone. And neck lump. This may be an alarming feature of low thyroxine level in your body. So this is low thyroxine level is also a cause of obesity. Hypothyroidism, we call in medical terms hypothyroidism. And features of high lipids. These are in medical terms, we call it xanthelasma and xanthomata. So there can be plaquey white patches, white plaques around the eye, or some small lumps, especially over the joint areas. This indicates that your body lipid levels are high. This can be seen in obese individuals, especially when they have familial tendency. So when you are having problems, when you are having obesity or obesity related problems, what test doctors do? They do a full blood count to see your red blood cells. Sometimes it can be high, and most importantly, fasting blood sugar. When it is more than 126 milligrams per deciliter, we call it diabetes. And also there's a test called HbA1c that shows how good your sugar levels within last 3 months. This is a very good test actually that can diagnose diabetes, and we check your cholesterol levels, the good cholesterol HDL and the bad cholesterol LDL. these ranges are for a healthy individual, the ideal range levels of cholesterol, but this can differ, especially depending on your underlying problem, like if you have diabetes or if you have heart disease, these cutoff values are lesser than this. And then, as I said, the thyroxine, low thyroxine level is a cause for obesity. So we check your TSH level to see whether there's any problem. And then the cortisol is your stress hormone level, and check liver function test as well to see whether there's any liver problem related to obesity. And there are many more tests. These are the basic tests that we check to diagnose or to find out the secondary cause for obesity. So the most important part, how do we manage? Dietary changes and exercise are the mainstay of management. So apart from that, as I earlier mentioned, there can be emotional problems related to obesity. So we offer behavioral therapy, and later the doctors decide and start on prescription medication, and finally, if necessary, doctors offer weight loss surgery. So exercise, because I'm not going to talk in detail about diet, because Dr. Virajni will give you a great idea, and also she will explain about how the dietary management, importance of dietary management and ways of dietary management. So this exercise is the other most important modality. So usually we recommend about 150 to 250 minutes of moderate intense activity every week to keep you away from obesity. So due to the large size of leg muscles, walking, swimming, running, and cycling are the most effective means of exercises to reduce body fat. About 0.5 to 1 kilogram per week weight loss is safe at the beginning. Behavioral changes, because these patients, obese individuals, will have a lot of emotional, psychological problems. So counseling is an effective way. And apart from that, support groups are also used, because they can share their thoughts, they can do their activities with the support groups. So it is a very effective way of managing obesity. And anti-obesity pills, orlistat, sibutramine, and phentermine, topiramate. Those are commonly used medications. And apart from that, anti-diabetic medications like metformin, exenatide are also used as anti-obesity pills. How do they work? They work by reducing your appetite and reducing fat absorption and increasing energy consumption and metabolism, and also thermogenesis. Who gets pills? So this should be decided by a doctor. So when the BMI is more than 30 or BMI is more than 27 with weight-related risk factor, it should be prescribed by a doctor. It's a prescription only, so it should be prescribed by a doctor. So usually you can't go to the pharmacy and ask for an anti-obesity pill. Why? Because there are unwanted effects of anti-obesity pills. They can cause high blood pressure, they can increase your heart rate, you can develop palpitation, glaucoma, some people can become restless, agitated, and they can have sleep problems, and especially some of the drugs which reduce fat absorption can cause oily stools, stomach pains, and flatulence. Then surgery. Who needs surgery? When the BMI is more than 40 or when the BMI is more than 35 with weight-related medical problems. And also weight more than 45 kilograms above the age and sex defined ideal body weight they are candidates for surgery. So there are a lot of surgical methods. Usually in surgery, what they do is they reduce the food absorption area by cutting parts of the stomach or by applying some stitches to reduce the part absorption area of absorption. And then other surgical treatments are like applying a band to reduce the absorption area, also doing some bypasses. They bypass the stomach and then they go to another part of the gut, your digestive system. So some of the food particles, they won't get absorbed, and especially the fat absorption and carbohydrate absorption will be less, and then that will lead to a weight reduction. And this is also another picture showing a duodenal switch, or this is also another bypass type of a surgery. And there is another surgery, probably you must have heard about this surgery, called liposuction. Actually, this is not a commonly practiced one, but this reduces the fat in your body. The doctors use some instruments to take out the excessive fat, and usually over tummy area and thighs, this is done, but this is not a surgery usually we recommend, because this again, the fat can get deposited and we might need several times of liposuction, and there are a lot of problems associated with liposuction. This is a sort of a cosmetic type of a surgery. Right, as I said, there are several types of management in obesity, and most importantly, the diet and exercises. Those are the mainstay of treatment. So Dr. Virajini will talk more about diet, and she will give you a good overview about dietary management. So I'm going to invite again Dr. Udari to introduce our next speaker, and thank you very much.
Thank you very much, Dr. Lushanti, for that interesting but rather frightening presentation on complications and alarming signs related to obesity and also the management of obesity. And at this point, I would like to remind you all, all those who are interested in reducing the weight, to fill up the Google form by just clicking on the link on the official Facebook page of VVOGA. So finally, we shall focus on the most interesting part of this webinar, which all of us are so keen to know and practice. Let me call upon Dr. Viraj Niratnayaka, a registrar in clinical nutrition, to advise us on what to eat and what not to eat. Over to you, Dr. Virajini, to present on medical nutritional therapy.
Thank you, Dari, for kind introduction, and hello and good evening, everyone. Firstly, I would like to thank the medical subcommittee of Visakha Vidyalaya OGA for inviting me to present in this timely important webinar on management of obesity. So you already know now the causes of obesity and the consequences of obesity. We will talk about how to lose weight. As Dr. Nilangika mentioned, there's a problem on the energy balance. So what we need to do is we need to create a negative energy balance in your body. So for that, firstly, we need to reduce your energy intake by cutting down excess calories in the diet. And secondly, you need to increase the energy expenditure. For that, you can engage in some physical activities so that your calories will be burned for the activity, and as well as your metabolic rate will be go up and it will use more and more calories. You must have seen this statement, lose 10 kilos just in 4 weeks. It is an amazing, promising statement. So you must be thinking whether this is possible, and is it a healthy way of losing body weight? So for that, people have developed fad diets. Fad diets are promising and popular diets, and it gives a rapid weight loss. There you have a ketogenic diet, intermittent fasting, low carb diet, fruit diet, and modified Atkins diet. Ketogenic diet and the intermittent fasting are the most popular ones these days. And the ketogenic diet, you are allowed to eat a liberal amount of proteins and fat, and you are restricted on carbohydrate intake for about 50 grams per day. And intermittent fasting also, there are different ways of following intermittent fasting. The most popular one is the 16 and 8. You must have heard of that. There you need to fast for 16 hours continuously, and during the rest of 8 hours, you are allowed to eat what you like. So, is it really unhealthy? Some diets are advantageous in certain ways. The ketogenic diet, intermittent fasting, any diet can lead a rapid reduction of body weight, and it reduces body fat, and those are associated with it increases the sensitivity of insulin in your blood. Insulin sensitivity is going up, so your blood sugar levels are well controlled, and it also reduces blood LDL and triglyceride levels, which are also known as the bad cholesterols in your blood. So why you not follow a fat diet then? Because it is associated with a lot of adverse side effects. It is associated with a remarkable loss of muscle mass. And there are a lot of practical barriers associated with those diets, because you need to cut down a certain types of food types, and you are strictly adhered to during timings, and there are practical difficulties, and you have to deviate from your family and social routines in following on some diets. And there are side effects as well. You will feel low energy, and you will have headaches, and there will be concentration issues that will adversely affect on your professional performances. And also it will give you muscle cramps, abdominal pains, and in long term you can have kidney stones, and there will be definitely vitamin and mineral deficiencies. And most undesirable side effect is the rapid weight gain once you are back on your normal diet. So that's why, as medical professionals, we always promote you on to have a healthy diet for a healthy change. So this healthy diet is nutritionally balanced and not deprived of certain food groups. It is sustainable. You can practice this dietary pattern for your life. And it is a family meal. Even your 3-year-old child can have the food items on your plate. And we are usually targeting 2 to 3 kilograms per month, but you can go up to more kilograms.
I think there is some technical problem with Dr. Virajini. Until she comes up, I would like to remind you all again to fill the Google form, which is published in FB page, if you are planning to reduce your weight healthily. And I think this topic is so important to most of us because we are receiving so many questions for our panelists. So until Dr. Virajini comes online, I will direct one question to Dr. Lushanti. Dr. Lushanti, would you be able to answer this question?
Yes.
So, okay. Someone is asking, how successful is weight reduction surgery, and where are these surgical facilities available?
Yeah, actually, we do weight reduction surgery for selected individuals, especially doctors decide. As I earlier mentioned, there are criteria for that. It is the successful rate is very promising, actually. About more than 50% weight reduction can be achieved within about 2 years. And usually after this surgery, most of the complications related to obesity, like diabetes, high blood pressure, the metabolic syndrome and heart disease, all these can reduce or can reverse even. So there are good effects, and especially the weight reduction wise, about nearly or more than 50% of the weight reduction, but it depends on the type of surgery, because earlier in my slides I explained several types of surgery. So all these can't doesn't give all of these usually have about 30 to 40, but most of these, but some of the surgeries actually have about 50% reduction of the excess body weight. And this is available in Sri Lanka state sector as well as the private sector. And so for Colombo people, actually, Colombo South Kalubowil Hospital, the Colombo South Teaching Hospital, has a very good bariatric surgery unit. That is, we call it as bariatric surgery. So there are several places. If someone is willing, actually, we can help and we can refer them for necessary investigation and workup.
Thank you, Dr. Lushanti. I think it's a very promising answer. So since Dr. Virajini is not yet online, there is another question which can be directed to Dr. Nilangika. Nowadays, we see so many children with obesity as well. So are we using the same BMI cutoff values to see if the child is obese or not?
Yes, Dr. Dari, it's a common problem now, childhood obesity. A lot of children are affected, especially in the developed world. But even in our country, we see a higher tendency of children being obese. But we can't use the same cutoff values that we used for adult obesity to define childhood obesity. You have separate growth charts for them. Depending on their age and their gender, whether it's a boy or a girl, you need to plot the weight and the height in a chart. There's recommended charts from World Health Organization, and then decide on whether the child is obese or not. So the cutoff BMI value of more than 30 is actually a very high level for a child. So it's not the same BMI cutoffs that we use for children. You have separate separate growth chart for children. It's not the same ones.
Thank you very much, Dr. Nilangika, for that answer. And there is one other question for you. There's a question: what is the best way to reduce weight for a person who has gained weight by consuming excessive hormone pills? Will you be able to answer that one?
Again, Dr. Dari, weight gain due to hormonal pills, I think she refers to estrogen and progesterone oral contraceptive pills, I guess.
Yes, I think so.
Yeah, so contraceptive pills, again, is a known cause for weight gain. But when the patient is affected by that, the same modalities are valid for weight reduction, that is diet and exercise. Diet and exercise, you must follow a regular dietary plan. I think Virajini will explain it in detail. Diet, where it will create a negative energy balance, and then exercise, around 150 to 250 minutes per week, roughly. Exercise and diet is again the mainstay. So obviously you have to stop the pill and then start on a diet plan and an exercise plan. That is the mainstay of reducing weight, even if it is induced by hormonal pills.
Thank you very much, Dr. Nilangika, for that answer. Is Dr. Virajini online now? If not, there is one more question on weight reduction. I think it's a personal question, but anyway, some viewer is asking how to reduce 20 kilos of weight, how much calories per day they should cut down to reduce 20 kilos of weight. I think it can be answered better by Dr. Virajini, but since she's not available right now, can Dr. Nilangika or Dr. Lushanti answer that question?
It is also same as like earlier mentioned by doing diet and exercise. So both ways are the most effective. So when we have to check the person who is having this problem, we have to check the other medical, whether the person is having any other medical problems and whether she is on any medications or whether she is having any other underlying problem. And then depending on her background, we have to specifically do we have to make a specific dietary chart, and then also the exercise also depending on the underlying, because usually if there's any underlying medical problem, we do not advise on the specific exercises. So depending on that, we have to actually individualize the management plan. So probably she can, if she can fill up that Google form, and we can get back to her later.
I also think that will be the best choice for her right now, because our medical subcommittee is conducting this program on weight reduction, and we are planning to give individualized dietary plans. So I think she will be benefited if she can fill up the form and join the program. Dr. Virajini, are you there? Because there is one more question, but it is straightly related to Dr. Virajini's area. It's asking, is it okay to reduce weight by keto diet? Example, 80 to 65 kilograms, and maintain the weight by normal diet. If she's there, she's the best person to answer that. But
until Virajini is back, we can give the audience a simple answer on that if you want, Dr. Dari.
Yes, please, Dr.
Yeah. Virajini will give more elaborative answer, but just to tell you, both the keto diet and intermittent fasting, both these diets will actually cause a very rapid weight reduction. So you can achieve your goal within a very short period of time. But the main disadvantage is once you go back to your normal diet, or once you go back to your normal lifestyle, the weight loss that you achieve through the keto diet or intermittent fasting, it is very difficult to maintain that. Now in keto diet, you exclude most of the carbohydrate part in your diet. And in intermittent fasting, you are fasting for 14 hours or so for a longer period of time, and then you consume whatever you want. So that will actually drastically drop your weight within a very short period of time. But again, once you are back to your normal lifestyle, you will regain the weight very quickly. So it's not something very lasting. It's better if you can take all the portions, that is carbohydrate and other dietary portions, in a way which will create either a negative energy balance or maintain it at a zero balance. I think Virajini will explain this in more detail. Since she's back, we'll ask from her whether it's okay to do like that.
Virajini, are you back? I think Dr. Virajini is back online.
Join කියලා හරිනේ meeting ID.
There is one more question for us. What if the BMI is all right, but there is wrong distribution of the fat deposition in the body? If the patient, if one person is having big tummy, but his weight is okay, but his body appearance is not okay. So what are we to do with that?
So that's again, now more than BMI, waist hip ratio is the indicator which gives us an idea about fat distribution in the body. So if the BMI is okay, that means the patient is not obese or overweight. But still the fat distribution is in a way which is predisposing to unwanted medical problems. So that means the patient needs more exercise to reduce the fat in the, around the waist area. The fat distribution is not okay. It is not okay means that the waist area has a lot of fat deposition compared to the hip area. So then a lot of exercises to reduce, especially targeting the tummy, the waist area, to reduce the fat content there is recommended for a person who's having high waist hip ratio, but still within the reference range of BMI.
Yeah.
So it will protect her or him from entering into the hazardous area where high risk of non-communicable diseases are there. So target on doing exercises which will reduce the fat content in your waist area.
Thank you very much, Dr. Nilangika. I think our viewer might be satisfied with that answer, because it's a very common problem which is seen among most of the people, because some people look slim, but they are having a big tummy with all the sitting and waiting in front of computers and all. So I think the viewer might be happy with that answer. Although it is, some people do not like to do much exercises, I think exercise must be done to reduce that tummy fat. No? Dr. Virajini is back. So shall we continue with the rest of the presentation, Dr. Virajini?
Yes. Very sorry for the interruption. And we have been talking about the healthy weight loss and the features of weight loss that it has. So our target is to reduce 10% of weight loss in about 3 to 6 months. So we need to create a 500 energy deficit in the body, and it will give us a 500 gram weight loss in a week, and altogether within a month you will be using 2 to 3 kilograms of body weight. Next slide. Yeah, the next one. All right, we will talk about a reduced calorie diet. So how can you cut down about 500 kcal per day? If you look at this table, and there are few food items with respective energy quantities. 1.5 cup of rice or noodles pasta will contain about 180 kcal, and 1 tablespoon of butter, oil or mayonnaise will contain about 135 kcal. 2 tablespoons of sugar will contain about 120, and average tea bun will have 120 kcal. Fish bun, seeni sambal that you usually have during your as a afternoon snack, it will contain about 220 kcal, and piece of chocolate cake will have about 350 kcal. So how to cut off and what to cut off during a day? If you cut down half a tablespoon, a full tablespoon of butter, and a 1.5 cup of rice and a fish bun during a day, it will be around 500 kcal. And also, if you cut off if you cut off 1 tablespoon of butter, 2 tablespoons of sugar, 2 chocolate biscuits, and 1 cup of rice, it will account for another 500 kcal. And if you cut off 1 tablespoon of butter, 2 tablespoons of sugar, a piece of chocolate cake that you have consumed, the next one, it will be around 500 kcal. So do you think it's really difficult to cut off these food groups? All these are unhealthy food. The chocolate cakes, chocolate biscuits are not, you really don't have to take those daily. We'll go for the next slide. The next one. Yeah. So what you have to do is you make your mind be strong and make up your mind to go for your dream body figure. So you can have healthy the previous one, Dr. Maheshika, please. Yeah, 3 healthy main meals you can have with 3 healthy snacks. You can snacking on fruits and reduce the coconut milk, coconut oil, butter, mayonnaise used in preparing meals, and replace and avoid deep fried items like vade, samosa, rolls, and try meat and fish baked or grilled, not without frying in oil. And you can cut down added sugar in tea, and you can try a green tea instead. So you must be thinking why green tea will help me losing weight. Yes, it is not because it has a direct effect on your weight reduction, but it is a 0-calorie beverage, and it is rich beverage full of rich source of antioxidants. Daily, you need to drink 2 liters of water to prevent you going to dehydration. And the next slide. So I will show you a sample diet. It's around 1000 kcal. So this diet could be very much deviated from your usual diet, but this is I'm trying this only to make to let you know that you don't need to have you don't need to fast for long hours. You don't need to cut down different certain food types. You can have 3 main meals and 3 snacks and also reduce your weight. If you are very fond of your tea, you can have non-fat milk 200 ml without sugar, and at 11 a.m. mid-morning snack you can have a banana and a green tea or plain tea, anything. For the lunch you can have half a cup of rice with non-starchy vegetables, 2 pieces of fish and green leaves, and for the afternoon snack also you can have handful of nuts or yogurt or fruit or a with or without a plain tea. And dinner, it's preferred to have your dinner at least 4 hours before your bedtime, and that you can take half a cup of noodles, 1 cup of vegetables, 1 egg tempered with 1 teaspoon of oil. So strictly no late night snacking except for 0-calorie beverages like plain tea, coffee, like that. So is it really difficult to follow? You don't need to be fasting, and you don't need to cut down carbohydrates. You don't need to cut down dairy and fruits. You can have everything. And it is very important to incorporate adequate proteins in your diet, because once you start with the calorie restriction, your muscle mass start to break down to provide that energy, and it will leave you low muscle power. You will feel lethargic, and you will be remain with a disproportionate body shape. So this is the reason why we don't advise elderly obese patients to lose weight much because we want them to be with their maximum muscle mass to keep them active and strong and independent during their elderly life. And the other benefit of the proteins, it improves satiety through a hormonal signaling pathway. And very importantly, you need to restrict saturated fat because saturated fat is very well known to increase your bad cholesterol levels in the blood. And instead, you can incorporate healthy fats in preparation of meals and during the snacks. So what are the healthy fats? Healthy fats, you can have peanuts, almonds, salea, hurula, tuna, salmon, mackerel. Those fish contain a lot of omega-3 fatty acids, and the locally available pumpkin seeds, potang, and chia seeds, also known as kasakasa seeds. Those contain a lot of healthy fats, and olive oil, canola oil, also considered as healthy fats. And whenever you have to choose a healthy oil, you can use olive oil or canola oil, and select high fiber options always, because high fiber diet is very well shown to have give you a lot of health benefits. We'll move to the next slide. Next slide, please. Yeah. The other important problem that we face is the weight maintenance. Once you start with the energy restriction, your BMR sets into a lower level, so that the rate of the weight loss declines with time. And at that point, you need to step up your level of physical activities so that your basal metabolic rate will go up and your energy will be burned to maintain your metabolism. So with that, you will again, you will have a further weight loss. The next, there are few tips. You have to use a small plate and avoid watching television during meals, and improve variety of your diet, and do not skip meals. You have to learn to read food labels for nutritional information, because then at the end of the day, you know how much you have consumed. And do not stock energy dense food at home, and step up your level of physical activities. So my most important message is that do not transmit the unhealthy food habits to the next generation, and initiate the behavioral transformation from unhealthy to healthy lifestyle, and try to eliminate obesogenic environment at your home. And very, very importantly, protect your loved ones from obesity and related complications. So this is the end. We'll eat healthy because you are what you eat. Thank you for listening, and very sorry for the interruptions that occur time to time.
Thank you very much, Dr. Viraj, for those important advices on how to eat healthily, and most importantly, that piece of valuable insight you gave us on transmitting the healthy dietary habits to our future generation. And although Dr. Nilanghika answered this question on keto diet, we have two questions on keto diet, which I think Dr. Viraj would be more informative, more comfortable on answering. There is one question saying that you said the effect of keto diet is not very sustainable, but a lot of people who are aiming weight reduction practice keto diet. Why isn't keto diet the weight reduction is not sustainable. Dr. Virajini, you're muted. Dr. Virajini, you're muted.
Yeah, I think you can hear me now. The ketogenic diet, actually it gives a very good rapid weight reduction, but it's not practicable to continue with in long term. There are so many barriers because you are strictly restricted on carbohydrate intake, so that you can't consume adequate proteins, adequate fruits, legumes, grains, rice, those carbohydrate rich food. So the essential micronutrients, vitamin and mineral contained in those food groups will be completely cut off. And also there will be a practical barrier in continuing when you're in social and family gatherings. You can't follow this diet, and you will have a lot of side effects in long term. So it's not advisable to practice this long term. Maximum you can go up to 4 to 6 months, then you have to shift again to a normal diet, normal healthy type of diet. This is why we call it is not sustainable, it's not healthy. So what you can do is you can shift into a healthy dietary pattern. It also will give you a good results, and when you get used to that pattern, you can practice it for your life.
Thank you, Dr. Virajini. The other question, I think you have answered in the last bit of the sentences you just told, but it says, is it okay to reduce weight by keto diet, example to 80 to 65 kilograms, and maintain weight by normal diet?
Yeah, that is fair enough. That's accepted way of healthy way of weight management. That would be okay.
Okay, thank you very much. So we are due to the time constraints, we will not be able to entertain further questions, but there is one more question, but I think this is very important for the person who has sent this question. So I will ask that last question from you all. How to prevent hair losing during dieting? Would Dr. Lushanti be answering that question, or Dr. Nilangika?
Yes.
Oh, okay, go ahead, Nilangika.
Yeah, I think Dr. Lushanti will also have something more to add.
Yes.
I will tell in brief. Now, she's asking how to prevent hair loss during dieting. So, hair loss is due to lack of vitamins and minerals when you're dieting. You need iron, zinc, and certain, like apart from proteins, hair growth depends on adequate amount of vitamins and minerals. So when you go on a diet, and if your diet is, if the amount of the things that you consume lacks the essential nutrients, vitamins and minerals necessary for hair growth, then you will lose your hair. So especially, as Dr. Virajini said, if you go on a keto diet, which will not have all the essential components, vitamins and minerals, then that may be a side effect of the keto diet. So if you are going on a diet, at least by pills, you have to take the essential nutrients. Iron and other essential nutrients are needed. And it is very important. That's why that we say it's not healthy to be on for a long time on a keto diet. Then you will not have all the nutrients, not only on keto diet, but even if you do very strict dieting, where you will not receive all the nutrients, that may be a side effect. So it has to be a balanced diet with reduced proportions of carbohydrate and all that. All the essential nutrients must be there. Otherwise, hair loss and other nutritional deficiencies can occur. Is there anything more to add, Dr. Lushanti?
No, I
Thank you,
think
Dr.
actually, as you said, the micronutrients deficiencies in micronutrients are the most important cause, and so especially we recommend to take iron, calcium, and sometimes vitamin D and zinc containing pills as supplements when people are on diet and when they are having this problem of hair loss. So if they are on a strict diet, we can consider giving these multi vitamin supplements.
Thank you very much, Dr. Lushanti. So we are few minutes beyond the time we were given, but I think we have been able to answer most of the questions our viewers have posted. So with that, we come to the conclusion of the webinar on obesity. I would like to thank our panelists, Dr. Nilangika Sandakumari, Dr. Lushanti Kannangara, and Dr. Viraj Niratnayaka for their very informative presentations. And I would also like to thank Professor Anuja Fernando for advising us and guiding us throughout this process, and the Executive Committee of VVOGA for allowing us to do this webinar, and the convener and the co-convener of the medical subcommittee, and the very hard-working organizing and technical team for their immense effort with all these technical troubles. And I would also like to thank all those who participated today for your active participation. And thank you very much and have a pleasant evening. Thank you.